So one of the questions I'm often asked as an expert in CGD is how can we keep patients from getting the frequency of infections that they used to get in the early days of CGD. So in the early days of CGD, patients would get infections, sometimes life-threatening ones, several times a year. And a whole host of studies have been done to try to sort out how to reduce that frequency of infection. And I might say that it's worth talking about the principle we're using to invent these things. CGD patients generally do not get infections with what we call commensal organisms. That is, things that normally live in our bodies, the ecology of our gut. So general gut organisms that are important for the functioning of the gut. This includes certain kinds of E. coli and so on, do not infect CGD patients. It's not the same as when a patient gets chemotherapy and has no neutrophils. And in that setting, your own commensal body organisms can cause problems. What we're talking about for the most part are infections that come from without. And so what the principle of prophylaxis is for CGD, infection prophylaxis, is to create a little bit of a fence, a barrier that the organisms from the outside that might infect a CGD patient have to jump over. I say this because another question I'm asked often by parents when their children are or adults on long-term antibiotic prophylaxis is, if I take this for my life or for years and years, won't I become resistant to this? And the answer is that that might be true if what we were trying to do is to prevent your own commensals, that is, organisms living in you all the time who would be exposed to these antibiotics becoming resistant. Instead, what we're doing is we're erecting a fence to organisms that aren't being exposed every day because they're outside the body. They need to jump the usual immune barriers, which are just a bit lowered in a CGD patient.